And the final letter of respect, which is the T, is really about transformation of gender norms, attitudes, and beliefs. And we knew that norms that condone violence, that condone this very dominant masculinity and this idea of subordinate femininity were contributing to higher levels of violence. So we
Mhm.
wanted to look at interventions that actually challenge those, what we call harmful norms around masculinity and femininity.
Did you know we can prevent violence against women and girls? Yes, we can, and we increasingly know what works. So join me with Dr. Avni Amin of the World Health Organization, who's going to tell us all about it. Some good news for a change. So, welcome to the Famous Podcast. And today I'm very pleased to have with us Dr. Avni Amin. She is a passionate feminist scientist with a fierce commitment to gender equality and women's health. She works at the World Health Organization in the Department of Sexual and Reproductive Health and Research, where she is the unit head of the unit on rights, equality, and well-being throughout the life course. I can't believe I said that correctly. And over her 20 years at the World Health Organization, Avni's primary focus has been on violence against women and gender equality. She's led the development of clinical guidelines for responding to child and adolescent sexual abuse, as well as the respect framework on preventing violence against women and girls, which we will discuss today. And I have the front page of the respect framework here. We'll be talking about this today. Uh, Avni is a lead author of the World Health Organization Global Plan of Action on strengthening the way health systems respond to interpersonal violence, particularly violence against women and children. She holds a PhD in international health from Johns Hopkins University. She is originally from India and considers herself a global citizen. And today she's joining us from Geneva. So, welcome to the Famous Podcast, Avni.
Thank you so much, Francoise, and it's such a pleasure to be here and to be chatting with you.
Yes, always is. And then we've worked over the years on these issues. So I feel really happy to be able to bring you in. One of the reasons I really wanted to have you on the podcast, apart from your brilliance, is because you and your team have made the case that violence against women and girls is preventable, which is really, really important. So it's not an immutable thing, that is the same everywhere and it's just a fact of life. It can rise or it can fall, and governments can do things to change the situation and reduce violence against women. So we can change things for the better, and we need to hear this these days that there are things that we can do to make the world a better place. So, can you tell me a little bit about that? The notion that violence against women and girls is preventable. Um, do we know what works? I mean, how should we think about this?
So I'll answer this question in two parts.
Mm,
The first is, a sense that violence against women is preventable by looking at the fact that the prevalence is not the same across different countries and settings.
mm-hmm,
So WHO has been at the forefront of leading work on putting violence against women as a public health issue. And in order to do that, we have looked at the prevalence and estimates of violence against women for at least a decade. Now, in 2013, when we put out the first set of estimates, we were looking at data from 80 countries. In 2025 November, when we put out the third round of estimates, we were looking at data from 168 countries, so almost
wow.
twice the number of countries.
Yeah.
And when we looked at the prevalence estimates by SDG region, by World Bank region, and across different countries, what we found is that the prevalence varies. Some countries have very high rates of prevalence of intimate partner violence and or sexual violence, which are the two most common forms of violence. And some countries have very low prevalence. And what that tells us is that violence against women is preventable.
Mm.
Basically, the risk and protective factors in these different countries are different. Some countries are doing well because they have more protective factors in place, and that helps reduce or keep the prevalence of violence against women lower. And some countries are not. And that should give us the first sort of set of clues around the fact that this is not an inevitable problem.
Mm-hmm.
The second thing I wanted, the second part to this question is that in the last 10 to 15 years in particular, there have been a lot of efforts to actually show that violence can be reduced or prevented in a reasonable, what we call a programmatic time frame. Now, most donors will give us funding to implement programs for, let's say, 2 to 3 years, or 3 to 4 years, or 3 to 5 years.
Yeah.
And feminist movements, particularly women's rights groups, have been at the forefront of developing innovation around prevention intervention. And in the last 10 years or so, we've been lucky that there have been some good donors who have supported not just the experimentation and innovations by feminist groups, but also bringing researchers together with women's rights groups to evaluate those innovations. And what we have found is basically that prevention is possible within a reasonable, when I say reasonable, I don't mean just 6 months, but within, let's say, 2 to 3 year programmatic time frames. And we can evaluate, we can show what is working. So some of those lessons around prevention have actually been synthesized and aggregated into the respect framework, which is what you mentioned earlier
Mm-hmm.
to your audience. And we've tried to showcase not just what works, but also the guiding principles around success and what needs to be in place to actually implement these interventions in a much more rigorous and successful way. So that is basically the two-part answer to what you
Mm-hmm.
asked, is that we know it's preventable, but we're also learning how prevention works in practice.
Mm-hmm.
And of course, to give credit where it's due, it is really a lot of it is innovation around programming led by feminist groups in the community.
Mm-hmm. And is that one of the reasons you've been working on these issues for such a long time? You know, you've dedicated a large part of your career to combating
Yes,
violence against women, addressing it, preventing it. Is that what has kept you interested? The fact that there's something that can be done.
absolutely. I think one part is around the fact that we know it that there are efforts that make it happen. I think the second part that has kept me going is that it does take time. So time is not, unlike clinical interventions, behavior change, social norm change interventions at the community level do require time and patience and constant sort of efforts to pilot, test, replicate, and learn. But also because I want to make sure at some point that all these interventions that are being evaluated can be brought to scale,
Mm,
and that requires working with governments.
yeah.
And working with governments, as you know, is always a lot of time, effort, advocacy, hand-holding. By the time you get to a point where a government is willing to take on board, they change, and sometimes you take one step forward, 2 steps back, and then go back again.
Yeah.
So, yeah, that's what has kept me in this field for such a long time.
Mm, mm.
Both optimism, but also patience, knowing that this is a long-term effort we have to keep at it.
That's right. And being at the World Health Organization is a good platform for that because you're working with governments very closely, advising them, providing them with normative guidance as well as programmatic guidance. So it's a good place to
Absolutely.
do it.
So, absolutely. And it also is that we don't just work in isolation. Of course, the World Health Organization primarily works with ministries of health, but this is a multi-sectoral approach that is needed. So you have to work with other sectors such as education, police, justice, social protection, And this is where, World Health Organization works with partners. And in fact, if you look at the logos on the respect framework,
Mm-hmm.
we have really tried to make sure that this brings in a huge number of partners, some who are working with the education sector, some who are working on social protection, some who are working with legal and justice sectors. So the idea is together we have a common framework to advance evidence-based prevention, capitalizing on each of our comparative advantages and mandates.
Yeah. I mean, there's all the UN agencies, relevant agencies. There's the World Bank, and then different governments, donor governments, Canada, Sweden, Australia, Netherlands. I mean, it's exciting. So tell me about this respect framework. Why was it developed? Did you feel a need to at some point consolidate the knowledge about what works to prevent violence against women? What was the impetus?
I think the impetus was we were getting to a stage, I think in 2017 and 18, around that time, we were getting to a stage where there was an emerging body of evidence around interventions. Many of them were small scale pilots, implemented largely by NGOs. But we wanted to provide some coherence around what was showing success or what was promising, and also indicate to people around what was not so successful and not should not be implemented.
Right.
And so we started to synthesize this evidence in the field, the emerging evidence in the field, and aim to provide some coherent narrative around what works and what is not so successful. Because governments were picking up on a small scale, governments were beginning to get interested in prevention and scaling up prevention. And we didn't want governments to scale up things that were not working and spend a lot of huge amount of resources on that.
Mm-hmm.
So that was the thinking behind the respect framework. And so we looked at what the evidence was, systematic reviews, and we came up with interventions that worked in the education sector, in social protection, that were being implemented through different population groups such as couples, men, women, economic interventions, and try to give some sort of an easy mnemonic that people would remember. And that's how respect was developed as a seven strategy framework. And each of the letters of respect stands for each of the seven strategies. So the
Mm-hmm.
R in respect stands for relation interventions that strengthen relationship skills by working either with couples or with individuals, but with the aim of improving communication, managing conflicts in relationships in a more peaceful, nonviolent way. The E was really around interventions to empower women. And we knew from evidence before that a lot of women stayed in abusive relationships because they didn't have any other economic alternative.
Yeah.
Many of them were financially dependent on their abusive partners, and therefore we wanted to look at how economic interventions, whether it was cash transfers, microfinance, or collective empowerment interventions helped women escape those abusive relationships. And that was the E of respect. The S has been something that for the longest time, the violence against women field has always provided, which is including a range of services, counseling, hotlines, crisis interventions, police, women's police stations, health
Shelters.
interventions.
Mm-hmm.
Yeah, exactly. And so we consolidated all the service interventions under the S. The P is around poverty reduction. And here, what we found is the research was showing that somehow giving just basic cash to households, very poor households, seemed to reduce economic stress. And that reduction in economic stress somehow, even if it was not intended to reduce violence, actually helped
Hmm.
uh, reduce the triggers for violence that were around economic stress. And uh, the second E, was really around what we call ecosystem interventions. So, ecosystem interventions in schools, in workplaces, in public spaces. So, programs like Safe Cities, where you have better lighting, better public transport,
Mm-hmm.
or schools where you have whole of school interventions, where you have a school-based policy to reduce corporal punishment, but also bullying and peer violence in schools was the second E,
Mm-hmm.
the enabling safe environments. And the C was because we knew from the from the prevalence data that childhood abuse, child and adolescent abuse, was actually a risk factor for boys continuing to perpetrate violence into adulthood and girls continuing to experience violence in their adulthood. So we wanted to reduce those childhood factors, and that's the C, the child and adolescent abuse prevention.
Right.
And the final letter of respect, which is the T, is really about transformation of gender norms, attitudes, and beliefs. And we knew that norms that condone violence, that condone this very dominant masculinity and this idea of subordinate femininity were contributing to higher levels of violence. So we
Mm-hmm.
wanted to look at interventions that actually challenge those, what we call harmful norms around masculinity and femininity.
Mm. And what have
So
you?
that in a nutshell
y-
is respect.
Yeah, that's fabulous. Like the and all the dimensions of the interventions that can influence the level of violence in society and in the family and in the environment is just amazing. Like, once you start thinking that way, you see all the opportunities for intervening and changing uh, all kinds of things, including, like you say, it could be lighting the streets better or making sure there are proper toilets in the school or, so that the girls are not vulnerable to some assailants if they have to go in the field behind the school. Things, simple things like that. Uh,
Yeah.
and
I think
also,
maybe,
sorry, and reducing child abuse and like corporal punishment in the family, which reduces the likelihood that you will become yourself a perpetrator or victim later on.
yeah, maybe just to add, the thinking behind this is really decades of research that showed that violence is the risk and protective factors of violence occur at multiple levels of what we call the social ecology. So, from the individual risk factors such as childhood exposure to violence to more structural level drivers such as what's happening in schools, what's happening in public spaces, what's happening at the community level of norms. We realized looking at the prevalence and the risk and protective factors over decades that you cannot rely on individual, there is no magic bullet.
Mm-hmm.
And that's really the key message of respect is that
Right.
there is no magic bullet. And therefore, you need multiple interventions at multiple levels of the social ecology to really make a dent at the population level in reducing violence.
Right. And when you talk about magic bullet, I sense that there have been some over the years that have, come and gone. What are some of those that turned out not to be that effective or not that magic at all?
I think for the longest time, people thought, oh, let's just go and do mass media education and awareness,
Mm,
as like this one point type of interventions. And many people invested a lot of money in these mass media campaigns.
yeah.
And what we realized is that mass media campaigns are just not effective in and of themselves. It's not to say that they don't have a role to play, but they have to be accompanied by more deeper work at the community level. They have to be accompanied by working with children. They have to be accompanied by working with women and girls to empower them economically. Just simply raising public awareness that this is a problem doesn't really do a job to actually change people's behavior.
Mm-hmm.
So that was, one magic bullet. In the health sector, a lot of people thought that screening women for violence was another magic bullet. And in fact, our evidence showed that, in fact, it is not even effective. So we, in fact, say, and WHO guidelines recommend not to screen. There are other alternative ways to identify violence. A
Mm,
third magic bullet was around interventions like one-stop crisis centers. You just sort of, again, go and put in one-stop crisis centers or women's police stations, as another magic bullet. And we found that in and of themselves, they don't work. What is required is multi-layered,
right.
multi-level programming.
Can you say more about that idea that the health system shouldn't screen for violence? In other words, when someone comes in as a doctor and you see something that should cause you to think this person may be uh, a victim of violence, then you should react. No, you should talk to them about it. But
Yeah.
what you're saying is not routine screening.
It is not routine screening.
Yeah.
So typically, screening is used as a universal screening, in particular, is used in public health as a way to identify conditions, but you actually ask and you actually subject everyone who walks into the health facility to that particular test.
Mm-hmm.
So let's say screening for pregnant women for anemia or screening them for a STI. You might do that and it may make sense, particularly because screening in that case is a means to an end. We have a treatment for anemia.
Right.
We have a treatment for STIs. If anyone is identified using the screening tool for an STI, you give them antibiotics.
Mm-hmm.
Now, in violence, we don't have a magic pill here. You don't, if anybody who comes into the health facility and says they've experienced violence, there is no magic pill.
Mm-hmm.
So, what we found is also that screening tools themselves. So asking women about violence in a very routine way was also not helping because most of these health providers themselves had very negative attitudes. So they would kind of, you ask a woman and then you tell her, oh, but it must be your own fault, or you must have done something to invite violence. And that attitude of health workers was actually putting women off.
Right.
It was traumatizing them, or what we call re-traumatizing women who were already traumatized by the violence in
Mm-hmm.
home.
Mm-hmm.
So, and the third thing is that screening requires that you have referral systems in place. And in most countries, very few referral systems or services are available, and those that are available are equally, victim blaming and stigmatizing. So you might screen a woman, and she may say, "Okay, I'm ready to go to the police." But then when they go to the police may actually not be trained, or the police might be miles and miles away for her to be able to access that service.
Yeah.
So what we realized is that screening as an intervention, it's not really an intervention, it's a tool to identify. And unless there is some minimum requirements or minimum services in place and that health workers are trained to respond to women in a positive, equitable way, there's no point asking health workers to just routinely ask every woman who walks in.
Right. Right. Right.
So the WHO guidelines, therefore, are more nuanced. We do say clinical inquiry, which is that if they see a bruise, they see a woman coming with repeated unwanted pregnancies, a repeated abortion, chronic sort of unexplained pain, or sleeplessness, or feelings, persistent feelings of sadness and loss of interest in routine life. All these are clinical clues, and based on that, the health workers should ask about violence. And before you do that, they have to be trained really well to ask in an empathetic way, to
Yeah.
ask in a non-judgmental way,
Mm-hmm.
and to offer a minimum basic response, which we call first line support. So any woman who is asked and discloses must, at minimum, be given that first line response, which is listening with empathy, asking them what their needs and preferences are, giving them validation that it's not their fault, they are not to blame in this situation, asking them about their safety, and then asking them what additional support they want, and refer them accordingly.
Right.
So we call it first line support, and we have a really nice mnemonic for it, which we call lives. So identify through clinical inquiry and offer lives is the basic package that WHO recommends, but we do not recommend universal screening.
Yes, yes, that makes a lot of sense now that you explain it. Now, tell me, how was this developed? Because there's all, as you say, these little studies, bigger studies, some studies in developed countries, some studies in, countries that are less developed. How did you assess all the evidence? And then I saw that there was a participatory process at some point. How was that used in developing the framework?
So, so for respect, We actually looked at all available systematic reviews on different areas. So for microfinance and gender training for the empowerment component, the E, we looked at systematic reviews around cash transfers. We looked at systematic reviews of microfinance,
Mm-hmm.
etc. And similarly, for the relationship skills strengthening, we looked at systematic reviews of couples interventions, of group education with men and boys and with women and girls, etc. And we looked to see if there was at least two, if not more, interventions that showed positive outcomes. And
Mm.
we said outcomes not just related to norms, but also outcomes related to behavior change.
Yeah.
So, where we found that there was at least two interventions that showed positive outcomes, particularly on behavior change, meaning that reductions in violence, we classified them as promising.
Mm.
And where there was less than that, we said, okay, this is interesting, but we need more evidence.
Right.
And where there was negative outcomes, so screening, for example, we did have negative outcomes, or what I would say no outcomes, we marked them as ineffective.
Mm-hmm.
And that's how we graded the evidence. And we made it quite transparent in saying where the evidence was coming from. So if most of the evidence was coming from high income countries, we actually graded it for high income countries. And if most of the evidence in that field was coming from low and middle income countries, we graded it for low and middle. So when readers look at the evidence, they can see if it's promising, if it needs more evidence, or it's ineffective, and also where the evidence is coming from, whether it's coming from high income or low and middle income countries. And then make that decision. If they are scaling it up or if they are replicating it, then they can actually see whether it's applicable or relevant to their context, and whether it's something that requires more evidence and more evaluation
Mm-hmm.
before it is scaled up.
Right. Yeah. And the participatory process, who did you
The
bring in?
participate, so beyond the systematic reviews, we had multiple consultations and multiple online as well as one in-person consultation where we brought in women's rights groups, we brought in donors, we brought in researchers, and we got them all together to say, okay, what is making sense to you from a women's rights perspective as practitioners, from donors' perspective as funders, and from research perspective in terms of parsing the evidence. And we did that multiple times. As I said, we had a couple of online consultations, we had in person meetings. And then subsequently, when we updated the respect framework after it was published in 2019, we published the second edition. We also developed a similar process for the humanitarian settings. We had systematic reviews. We also consulted all the practitioners in the humanitarian settings. So we had the International Rescue Committee, the International Federation of Red Cross and Red Crescent.
Mm-hmm.
We had Save the Children. We had Voice, which is a network of women's rights groups working in humanitarian setting. And of course, we had the UN partners and some of the donors around the table
Mm-hmm.
as well.
Mm-hmm. So everyone really brought together for this. And the
Yeah.
second edition that just came out, was the main change including evidence from the humanitarian sector, from disaster relief in war-torn areas? Was that the main difference, or are there other differences?
The big difference was addition of a particular page around what the risk and protective factors were from the humanitarian context.
Mm-hmm.
And that was based on systematic reviews we had done looking at the addition, what I would call the additional risk factors in humanitarian context, and adding interventions in the humanitarian. But in the between 2019 and 2024, 25, when we were producing the second edition, uh, the UK government had come out with the um, first initiative called What Works to Prevent Violence Against Women,
Yes.
which had ended in 2022. And it had the first sort of 7 years of, efforts that came out with what was some of the new emerging evidence on this. So we wanted to include that
Mm-hmm.
in the update. And so we did another systematic review of reviews that we published in the BMJ in 2025, January, that looked at new evidence that had come out from the field and tried to make some changes and adjustments to account for the new evidence. Those were, I'm so sorry to say, but despite all of the work that had gone in, um, there were some things that didn't change much. There were a couple of small things that changed, and we did adjust the rating of the evidence. And we added a couple of new areas for consideration, such as I think by 2025, the digital online violence had become quite a big thing,
Yeah.
as well as people had started experimenting with digital interventions. So we
Mm-hmm.
started seeing some of that. But those were what I would call small, minor upgrades. The big upgrade was on humanitarian.
Mm-hmm. And what are some of the things that surprised you the most over the years in reviewing that evidence? Things that you went, oh, so that's something we should really encourage governments and other actors to support to reduce violence. Are there things that were counterintuitive or you just hadn't thought about?
I think that one of the areas that I wanted to pick up on is this idea around economic interventions and economic empowerment.
Mm,
And I think that it requires a lot of nuance
yeah.
in what we say to government. So different economic instruments of empowerment for women work differently. So cash transfers versus microfinance versus women's labor participation and employment.
Yeah.
There are three different instruments and they work differently. Secondly, the context in which these approaches are introduced makes a huge difference about whether or not they are impactful in reducing violence or not.
Mm,
And I think we have in the last six years since I would say 2019 when we first provided the respect 1.0 have gotten a lot more sophisticated about unpacking those nuances. So cash transfers, as I said, seem to consistently show impact because just very basic influx of cash in the household reduce economic stress.
mm-hmm.
But I wouldn't call them empowerment interventions per se. They just gave cash to women and to the households to solve their immediate problems.
Relieve poverty. Yeah.
Poverty relief.
Yeah.
Now, microfinance interventions, uh, on the other hand, because they generate income and they generate opportunities for women to come together and also make a difference whether or not they come in tandem with additional component added to it. So if they use these self-help groups and microfinance groups to collectively empower women, to make them aware of their rights, to give them skills around managing money and managing finances and etc., can or cannot work in a context where they're introduced, where the husband or the partner has less education, less empowerment, they can actually be adversarially affecting their risk of violence.
Oh.
Whereas in a context where there is an expectation in the community, there's a forum or a critical mass of women that are already expected to go out and earn money,
Mm-hmm.
they may actually be beneficial.
Mm,
Secondly, if they are introduced in the short term, maybe in a 6 month period, they may disrupt the power balance between the couple and cause problems. But maybe over a period of time, things may improve and they therefore may be empowering.
mm.
So that nuance is now coming, to play in our judgment of economic and social empowerment intervention.
Yeah, yeah. No, it's true because, if I think of 10 years ago, microfinance was the rage and that's going to empower women and liberate them. And, they're all going to borrow money and start their little businesses. And that will be the, the magic bullet again. And as you say, some of it didn't work out at all. Some of it caused women to experience more violence because their husband wanted to grab the money that they were borrowing or investing, and and cause some, change in the power dynamics in the couple. So, this has to be done carefully and with attention to the environment. And as you say, the evidence seems to show that you have to do other things than just the micro lending. You have to do other programming in terms of financial literacy, self awareness, relationship skills, and so on. Like that's what and when I was reading the evidence, it shows, right? So that's a much more complex intervention. It's not that magic bullet that people are always looking for. Um, has the framework influenced donors?
Yes and no. Some donors it has, and some donors perhaps less so. So, very concretely, it did influence the World Bank's lending.
Mm-hmm.
World Bank very concretely took on the respect framework and used it in shaping their gender-based violence lending. So, from that perspective, yes. It for a while, as long as the US government was in place, we actually had guidance for country programs in the PEPFAR and USAID guidance around using respect as the framework or strategies in respect for intervention. But of course, for obvious reasons, this is not the
USAID
case.
is, rest in peace.
PEPFAR and USAID are no longer in place, but they did take up this framework and explicitly had their own guidance for their country missions using this. I think there are others who are definitely, including the ones that are on this list. The UK government is looking at respect as well. The Australian government is looking at it. I don't quite know to what extent their guidance for their country programs and missions has been affected by this, but definitely it has influenced. And within the UN Women is very proactively using the respect framework to support all their country offices in
Mm,
programming at the country level,
mm-hmm.
uh, for sure.
And have governments out there in lower middle income countries taken up the framework? Are they picking up on it to
Yes.
develop their programming? Yeah. Sorry.
Yes, some of them have, and some of them are picking it up. It hasn't gone as widely as we had hoped to drive a lot of programming, but
Mm,
some governments, and particularly, I will give full credit to our UN partners and to the World Bank in particular. I know in Ethiopia, at a particular moment in time when the Ethiopian government was updating its national action plan on violence against women, UN Women actually use the respect framework to help them update in accordance with the respect framework. In Vietnam, also there was a lot of effort with the UN Women and local partners. Um, in Nigeria, again, they had made an effort to scale up with the World Bank in Chile, Peru, and now they're also helping the government of Brazil to look at respect frameworks. So I think it's happening, but I wouldn't say that it's a big success in the sense that a lot of governments are taking it up.
and why do you think it's been slow in terms of the uptake?
I think what had happened is when we first put it out in 2019, we had just started working with UN partners to roll it out, and then COVID happened.
Right.
And so for about 3 years, we weren't really able to do a lot of dissemination and country rollout in a concerted way. And I think after COVID, the momentum really slowed down.
Mm-hmm.
For a lot of countries, there were other priorities. And as the UN also, I think funding was quite constrained
Yeah.
in the sector, and in general, funding over the last, I would say, 5 years has been quite constrained. So our ability to do proactive rollout and dissemination has been hampered to some extent. So yeah.
Mm-hmm. And one of the things that, of course, I'm very interested in is the role of feminist groups in all of this. Because as we know, one of the approaches that works the best is when feminist groups are funded to address violence against women and girls, because they're one of the most effective agents of change when it comes to addressing violence against women. And we know this from the evidence that's been gathered by Professor Weldon at Simon Fraser University, amongst others. And so independent feminist movements are a key actor in placing violence against women on the agenda. How is that reflected in the respect framework?
So we actually make as an enabling factor in our guidance on how to implement. So we have the 7 strategies of respect,
Yeah.
but in our enablers and in our guiding principles, we have a very explicit call out that one of the criteria, apart from addressing laws and policies, must be investments in feminist movements and
Mm-hmm.
grassroots women's rights organizations, because we know that without that, nothing can really happen. Of course, we know that it's not an either or, and that feminist movements and women's rights groups cannot shoulder the burden of what duty bearers are supposed to do.
Right.
So they should not replace the obligation and the role of the state and the government and the state institutions to deliver care and this thing, but they are at the community level very instrumental, and so we do explicitly ask that there is an investment in them as an enabler. And then in the guiding principles, again, we make a call out to participatory approaches that involve local community groups at different levels of the social ecology and
Mm-hmm.
on partnerships with them. And it's very clearly acknowledged that this is a field that has been built, as I say, on the backs of the feminist movement. But it is also a field that requires governments to step up and play their role and assume their obligations, due diligence obligations under the international human rights mechanisms to step up as well.
Yes. Well, thank you very much for this. I really urge anyone who's interested in learning more to read the framework. It's a very easy read in a way, because you have all these examples of programs, couples therapy, couples counseling, changing the environment, empowering women. There's lots of very concrete things that are described there in a very it's very easy to understand, the effectiveness of each intervention and so on. And you have a lot of examples from countries, from Rwanda to Peru to China. So it really gives you a sense that this has been a global effort. Like, there's a lot of people invested in this who want to reduce violence against women and girls for everyone's benefit. Obviously, I mean, we all benefit from that, men, women, and everybody else. So I really thank you for the work you've been doing. It's just brilliant and so brave, and keep at it. And I encourage everyone to take a look at this and get some inspiration from that, to see that yes, we can reduce violence against women, we can prevent it, we can stop the intergenerational cycle of violence. Yeah, a better world is possible.
It is possible, Francoise, but I'd also make a plug for if people are interested in going deeper into how to operationalize this framework in practice. UN Women has actually developed an implementation package, which is on the UN Women's website.
Aha.
And that gives you a much more deep dive into each of these 7 strategies, also around monitoring and evaluation, and this is for people. I mean, I think respect is a framework largely for policymakers, recognizing that many of them want to get a snapshot of what is evidence based, but they may not want to go in deep into
Right, the
the
weeds.
how to,
Yeah.
into the weeds. So it's to get their attention. But also, we recognize that there are a lot of people who could actually help operationalize this. And for them, we have to, I would say, UN Women in particular has led the development of the implementation and getting into the weeds. So
Right.
do look at that as well.
Well, that's a beautiful example also of interagency collaboration and building something together that's bigger than
Ab-
yeah, the sum of
Absolutely.
the two
Yeah,
efforts. Yeah,
absolutely.
yeah.
Yeah.
Fantastic. Congratulations. I'm very excited. When I saw this second edition coming out in the fall, I'm like, I have to talk about this with Avni. So thanks for taking the time. And
Thanks a lot, Francoise.
yeah,
Thanks, and such a pleasure and such amazing work in getting all of these great work that others are doing to the public. So thank you so much for what you do as well.
thank you. A luta continua.
Exactly. Together.
Bye.
All right. Bye bye.